Good morning, everyone. It is 10 o'clock and it's time to start our weekly coronavirus virtual information session. I want to welcome everyone to the session. My name is Anna Fall. I'm the Executive Director of the Traeger Institute. We want to ask you all to keep your mics on mute. And if you want to ask a question, you can type it in the chat. Or if you want to ask a question in person, that is fine too. If you do not want to be videotaped, then put off your video. If you are concerned about your health, call us at 588-4340, or you can call the COVID hotline at 1-800-722-5725. Next slide. If you have any issues with your sound, you can see here on the screen where you can go next to the unmute button. You can click there on the arrow and you will be able to do some troubleshooting there. And then we want you to please go ahead and type in the chat the county that you represent. I would really appreciate that. Throughout the time, throughout the hour, if you forget to do that, make sure that you that we have you listed so that we can know who we are reaching. So today, again, we're going to have another moment of silence and reflection to honor the over 2 million American citizens that have been infected with COVID-19. And this week we have lost an additional 4,000 people who died because of COVID-19. We also will use this minute of silence to reflect on a society who is battling racism and systemic injustice. Let our moment of silence begin. Thank you. So today we are excited again to have Dr. Laura Morton back with us to share with us the weekly update from the medical field. Thanks, Dr. Morton.
Good morning, everybody. Can you hear me?
Yes.
Very good. All right. So thanks for having me. Sorry about the hair. I got back from the nursing home this morning. Just want to give you all an update. So currently at University of Louisville Hospital, there's not as many COVID patients. So that's a very good thing. They used to have a COVID floor as well as a COVID ICU. And now the patients are in the ICU. And then once they're out, the hospitalists will see them. Yesterday, if you watched the update, there were no deaths in Kentucky. So it's been the first day in a long time. So that's a good thing. We've had 13,839 total COVID positive cases in Kentucky, and we've had 526 deaths. We tested over 352,000 in Kentucky, so that's pretty significant numbers. The other thing is that across the nation, I'm sure you've seen in the news that there's been a lot of increase in cases. In about 20 states, they are actually seeing a spike. Kentucky continues to be on a plateau. There's some up and down fluctuation, but we're still in the plateau, fortunately. The other thing that's going on is June 29th is a big day. It's Healthy at Work. So some of the other things that have been closed are going to open back up: bars, wedding venues, and groups of 50 or less. Also some youth sports. The governor continues to recommend hands, face, and space. So we want to wash our hands, wear a mask, and keep our 6 feet of social distancing. The other thing is he talked about what you normally do, doing only about 50% of what you would normally do in a day. So if you would go out to eat twice a day, then he would say either go out to eat for lunch or dinner. The other thing I want to give an update on is the long-term care task force, because I think everybody's very anxious and concerned about where we're going and what we're doing with our facilities. There's been extensive widespread testing across the state. It's still ongoing. Hopefully all of the long-term care facilities will be tested by the middle of July. And the governor had mentioned the dates, but June 29th is when they should be, and there's guidance pending, communal dining and activities that are going to start. And that guidance is coming soon, as well as July 15th is the date that there should be some form of visitation in the facilities for families. And again, guidance is pending, more to come. So keep your eyes open, but that is the exciting news, because trying to figure out how to safely open the facilities back up, recognizing that our older adults need that social interaction. So very exciting times and more to come. Thank you.
So this morning we are very excited to welcome Ben Reno-Weber. He's the director of Microsoft Future of Work Initiative. He's a social entrepreneur, and he has run tech startups, nonprofits, and government programs in the US and abroad. And his current focus is on the generational change and recent advances in technology, and what that is going to mean for the future workforce and an aging population. In 2019, Ben became the director of the Microsoft Future of Work Initiative. It's a Microsoft-funded nonprofit initiative focused on establishing Louisville as a hub for artificial intelligence, data science, and the Internet of Things. In that role, he works with companies, educators, nonprofits, and government agencies to understand the possibilities and limitations of the coming technological revolution, and how to take advantage of the opportunities while avoiding the pitfalls. He's the co-founder of the tech startup Mobile Serve, which is used by more than 250 organizations around the world to support more vibrant and engaged volunteer communities. He has served as the executive director for the Greater Louisville Project and the Kentucky YMCA, nonprofits focused on empowering engaged citizens. Previously, Ben has worked for the World Bank, the International Finance Corporation, and the Boston Consulting Group. He has a degree in international affairs from the George Washington University, an MBA from Harvard Business School, and an MPA from the Harvard Kentucky School. He serves on the boards of the St. Louis Federal Reserve, the Louisville Chamber of Commerce Enterprise Corporation, Lemonade Day Louisville, and the Awesome Foundation. And a little tidbit about him, that in his free time, he's a competitive eater, and he is currently holding the world record in both speed and volume of watermelon consumption. I find that to be a very interesting statement. So thank you, Ben. We are really happy to invite you here today to talk a little bit about technology and how things are changing because of COVID-19. Thank you so much.
You guys hear me? Okay. So thanks so much for having me. I'm super glad to be here. I think I really appreciate the focus that this group and as so many groups have on both the crisis that we are facing in terms of COVID, but also really the civic awakening that our entire country and particularly the community around Louisville is facing, where I'm really optimistic that we are having the kinds of conversations that we need to be having. So what I want to talk about today are three things, and then I want to open it up to Q&A. But I really want to be focused on what the opportunities that the confluence of these social changes, this crisis, and the emerging data technology are going to bring. So I'm going to say three things, and then I'm going to open it up to Q&A, and I hope we'll have a robust discussion. So the group that I represent with most of my time is the Future of Work Initiative, and it's a Microsoft-funded project to really stand up a hub for artificial intelligence, machine learning, and the Internet of Things in Louisville. And there's a number of reasons that I'm happy to talk about that they're choosing to make this investment in Louisville off the coasts. But really one of them is, even before this set of crisis, the leadership that we have in the aging care generally and healthcare more generally. So they're really excited about the opportunities that are available to us. So 3 points. First point, this technology is going to touch everything. It's a transformational technology, like the internal combustion engine, like electricity, like the internet. it's going to transform every aspect of our society. So we just need to be aware of that. We won't know all the ways that it's going to change things, but it is going to change them. The second thing is that there are layers to what we think about when we say artificial intelligence. That's a very scary term for a lot of us. It conjures up images of robots killing all sorts of things and a complete lack of privacy. And while those concerns are very real and we definitely need to be talking about them, there's an awful lot of opportunity for engagement and innovation well below. If you think of it as a pyramid, artificial intelligence is at the very top. Most of us are not really going to be doing a lot with artificial intelligence. But data, in all the layers from it first gets collected by somebody who walks into your door as a patient and then analyzed and visualized, that is going to impact all of our lives. And the third piece, and this is where I think this is really important for you all, and where I think, you know, the Louisville in general, and particularly the University of Louisville, has a real opportunity to be leaders in this. This is less about the technology and more about culture. When we come to understand the components of what is possible in terms of innovation, that's really going to be the key driver here. So those are the three things. It's going to touch everything. The opportunity is really for us to get out in front of these things. And this is in terms of understanding the layers of data and innovation that are possible. And we as the university and the Louisville community have an opportunity to really be on the front end of this. So it's going to touch everything. We don't know what exactly all the pieces that, for example, the internet shifted things at the beginning. There was some obvious, oh, I can send information, I can send files, there's email. But we had no idea that it was going to transform how we bought cars, because it was going to make information available that wasn't before. There are very few internet jobs, but there's an awful lot of, in fact, almost every job is impacted by the internet. That's what data is going to be like. When the data economy rolls through all the different pieces of our culture and society, we can't anticipate what all the next things are, but I think the real opportunity for this group is as we are forced to break the old models, because COVID is going to shift how we deliver care, how we collect information. There's a real opportunity for us to not be trying to repair what is broken, but instead look and say, well, listen, for example, in social isolation, this was a huge issue well before COVID, right? All of a sudden it's exacerbated, but there's an opportunity in that crisis for us to be really innovative, not just say, oh, okay, well, social isolation, maybe we could stick a Zoom screen in people's rooms, but reinvent the way that we ask and engage our elder communities with the broader community. Somebody is either yodeling or needs to mute or both. So I think the second piece is the layers of data before we get to artificial intelligence are really important. We right now have these EMR systems that are collecting data, but they're basically terrible. No offense to the system that we have or the Epic system that we're going to, but we have yet to really capitalize on what it would look like to have those data systems inform our practice. I think there's some really interesting stuff happening at the Traeger Institute. I see Dr. Ambrosio there. Trust me, you and I are going to have some conversations in the next little bit about what we can do to transform the way data gets utilized by practitioners. But that's going to involve us, again, taking advantage of this moment to really examine our practice and solve our business problems, which gets into the piece that I think is really interesting. Dr. Guam at the University of Louisville, who runs the really incredibly innovative analytics program within the business school, likes to say that the technology has evolved to the point where we can start focusing on the problems. And what that really means is that if we're going to be a center of innovation as a community and as a community of practice, we need to shift the way that we think about how we deal with data. And there's some incredibly innovative work happening at U of L within the Center for Digital Transformation as we look through the strategic plans around that. But what does that really mean is, here's an example. There is a referral platform in Louisville called United Community, in which any organization that's part of the system can refer people with social needs to other nonprofits or government programs. Once upon a time in the pre-data economy, we would have measured the success of that program entirely by, did we get people referred into the system and were those referrals accepted? That's absolutely a good metric. But in the data economy, knowing that we did not, that we failed, that there was a resource that we couldn't get people connected to, or that it took X number of days, that information is in of itself really valuable. And that's the cultural shift we need to start making, which is that all of this data is useful and gives us a platform for innovation, for understanding, for insight that we didn't have before. So those are the three things. I want to stop there and let this conversation go where you guys want it to go.
So Ben, I'm going to ask you a question related to work environments. Do you see that with the way that things have developed over the last 3 months, with companies who completely would never have thought that everyone is working from home, everyone is actually sometimes even more productive being from, in that home space. How do you see the work environment develop? How do we get that social energy back into the workplace, even though many of us are working remotely? And do you see a trend that will develop because of what we experienced in the last 3 months?
So if I could flip that question a little bit, I think I would come back with, what is it that we love and hate about this right now? And how do we get the things that we love, mitigate the things that we hate, but not lose this opportunity to reinvent the way that people work? So people are like, oh, when are we going to go back, or how are we going to go back? I think the bigger question is, do we want to go back? And if so, why? So you mentioned, the social engagements that people had. I think the real question that we should be asking is, what did we have that we valued? What did we have that we hated? What do we now have that we value? And what do we not want to have, or what do we now have that we hate? And can we create a way of working that works that addresses those things? It's like, I love not having to commute. I love it. I really intensely struggle with the absence of spontaneous interaction, right? Where I get to talk about what I'm doing and other innovators can say, oh, here's this thing. Have you talked to this person? Is there a way for us within this context to deal with those things? Like, I don't want to commute. Can we create a daily set of interactions where small groups of colleagues have a conversation that meets that need for me? So, and that's where I think that the real opportunity here is.
Hey, Ben, I have a question. You were talking about the data and how we need to really seize this opportunity to leverage the data. How do you see data governance playing a part in that, and how we can ensure the security of the information and the privacy of the information as well?
Yeah, I mean, I think that's going to be one of the major issues that we're going to be wrestling with in this whole next data wave is the data governance components. I think we need to, I think we really need to be thoughtful around what is good and bad about collecting, you know, these interconnected data sets together in ways. So if we, you know, the data governance is going to be its own area of innovation and insight. And honestly, we're going to need philosophers and ethicists in addition to cybersecurity folks. I mean, one of the real things that I think needs to happen is that we need to move data out of the realm of IT completely. IT, the technology is like, that's, you know, like that's keeping your computer on. Moving data into the cloud, that's going to be the province of IT. So thinking about how we leverage that data, but also protect our patients, ourselves, like that needs to be engaged on a strategic level.
Yeah, it really does. I mean, it needs to be an ownership kind of on both sides. The business and the IT have to learn to partner together. The business has to really, and when I say business, I'm talking about everybody who's involved from a healthcare side, who manages the patient as well as the IT side. You have to have a lot of controls around the data and ensuring that, you know, we're keeping it safe and that the intent of use isn't misguided. You know, I mean, with artificial intelligence, a lot of things can happen. Machine learning can make a lot of things happen. And I think data governance is just going to be a really important part of that. And I just wondered what your thoughts were on it.
Yeah, and I think we have to have a way more robust conversation than we're having right now. I mean, this whole thing that has been happening, and I'll pick on Dr. Fall and Ambrosio, like where, you know, they're really have struggled to interconnect different systems and social needs, and we just can't be like, hey, HIPAA, no, like that is just not going to work anymore. Same thing in the school system. We can't just be like, oh, FERPA, sorry, we'll never be able to share data. Like that just doesn't, that's not going to be enough for what is coming. Because what that's going to mean is that people are going to get so frustrated. I mean, I'm so frustrated when I walk into my pretty well-developed healthcare system and I still have to fill out a piece of paper again with all the information you already had. You want another copy of my insurance card? Why can't you do this? Like pretty soon, if we don't start shifting the way that we engage people's information, people that are going to do that are going to do it for us and to us. And so I just think that we need to start really having those conversations. And Dr. Fall, to your point, I mean, I agree. Lots of, not just older adults, lots of people are afraid of systems where data is shared. I think those fears are justified, but we need to start having much more robust conversations around what it would look like to address those fears rather than just stick our heads in the sand.
That's a very good point, Ben. I'm going to read a question from Joe. It says, we have been talking about technology innovation for a number of years. What do we need to do in order to accelerate change now so that we can stop talking and start changing?
I mean, I think it has happened to us, which is that we have to break the current system. You know, the whole resistance to telemedicine is just as one example. Fixed it, done. Right? Like, I'm sorry, telemedicine is reimbursable now? Oh, well, that changes everything. Go ahead, you look like you got something.
Ben, one of the things that I've noticed is that, so I'm a therapist, and one of the theories in therapy is homeostasis. People want to get back to what they had. So we're experiencing that at the Institute right now. People are saying, why are you not here? When are you coming back? Well, we're getting more work done at home than we've ever gotten before. It's easier on us, and we miss the hugs. We miss that camaraderie that we had for sure, because this is not the way. I mean, I'd like to give you a big hug right now if I could, but I can't. So we miss all that. But then again, how do we really change as a society? How do we break homeostasis to create something new, a new homeostatic system?
Yeah, and I miss the hugs and the touch, and we all know there's physiology around that. In the current environment, we're not going to be able to shift that, particularly for older adults. However, we can leverage this technology to do a much better job of engaging older adults in the social connections that at least meet some of those needs, that human interaction. And there were already, I had a technology that was engaging older adults in social good and volunteerism. And as part of that, we would go see all these technologies, but there just wasn't a lot of impetus or a lot of momentum behind how do we do that? And how do we really focus on those problems? And one of the things, talking to some of the payers in the system, is they hadn't figured out how to do the math on what social isolation cost them in a way that they could understand. So, and this gets into some of the pieces of what does translational research look like? Like, we can look at all of the work that's been done at U of L around the impacts of social isolation. What we completely failed to do was translate that into a patient population for Humana that they could say, oh, social isolation costs me $7,000 for my patient population, because Humana can't absorb the academic study as is. And this is where what they need to do is do an academic study on their patient population. And then all of a sudden they can say, sure, $7,000 a piece. Well, man, $7,000 will buy you an iPad for every single person that you cover, and a personal lesson every single day in how to get on Zoom, and a platform for where we connect older adults to school kids who are sitting at home. I would pay $100 a week to have older adults reading to my kids during the day while they are locked in my house with me. They're listening right now, so I will stop there. And so there's a marketplace, and this technology is not super complicated. But if we knew in a way that we could present to a payer what their costs were and then drive that up through the system, man, there's a lot of power there. And we know that, right? We knew that before. This whole pay for performance stuff, that's not new information, but this crisis is the opportunity for us to really go in and nail it.
So there's a question from Barbara Gordon. She's asking, social isolation of older adults is a major issue pre-COVID-19. COVID-19 has exacerbated this problem, and there are few remedies currently available to remedy the problem. There is also a need for real in-person human interaction. How can or how will technology help in this area?
Yeah, I think this is where there's a real opportunity for innovation to get accelerated. Yes, everyone would prefer to be in person, but hey, wouldn't it be neat if we, strapped on some a cheap cell phone and some Oculus goggles, which we were already using. You go to the Thrive Center, there's all sorts of therapy stuff around that. There's Behave VR. What if we built that system for social interconnections? It's not what if we replicated the coffee shop that, as mobility becomes more of an issue that, increasing numbers of older adults can't get to, we built that, there's a virtual Heine Brothers. I think there's some real opportunities here, and the technology is not, we just need to scale it. It's actually already there. So that's where I think the opportunity is.
Joy says, aiming to this transitional research discussion and bringing older adults into using technology, intergenerational connections using technology, I think is the key here. Do you have any guidance for us to avoid us to go back to where we came from? We don't want to go back to March where we didn't even think about technology. We want to be forward thinking.
I'm going to say this as a little bit of a challenge. This is going to be, and gets back to my second point, but this is about culture, not technology. How do we not go back? Leadership. This is going to be leaders stepping up, and I can see on this call, I saw Sharon Carrick on here earlier, obviously you all, and Larson, like there's some really powerful leaders within our community that could help us to do this. Now, within the university context, my dad was a university professor for 30 years, and he would say that a university is a set of warring tribes united by common complaints about parking. Well, it turns out we've gotten rid of the parking as an issue. No one's coming back. So what would it look like for us to try and unite the warring tribes? And I mean, this is where I think we also fundamentally need to shift, maybe not the incentive structure in terms of money, but the recognition structure of if your research can be applied or done in practice, right, then we can recognize and reward you in different ways. Now, I don't want to, I am a huge believer in a liberal arts education. I think that's really important. I don't think everything is about practicality. However, there is something in the research that gets done in conjunction with, our business partners that create better outcomes, right? It is one thing to notice that if you've got a holistic practice, my mother does much better, right? It is a different thing to say when we have a holistic practice, my mother costs less. And frankly, like that's just the hurdle we got to get over. And we also got to figure out, as I've been doing a lot of this AI work, and God bless Sharon Carrick for helping navigate me through this, there are 6 separate programs at U of L doing advanced analytics. And 2 of them had no idea that another 2 of them existed. Right? I'm the one going, hey, did you know that there's this really cool thing and Pfizer just funded a thing there? And they're like, I don't know what you're talking about. As the undergraduate speed school program is reinventing some of its courses, we're looking at it. And one of the people on the review committee was like, hey, I think pretty sure public health has a program that looks exactly like that. Can we cross-reference those courses? Like, yes. So I think that's this is less, again, it's less about the technology and, to address Barbara's question here, it's actually not about the resources. It's really a lot about the leadership and the openness of the participants to that kind of cultural change.
So here's a very important question, Ben. How the technology you are working with impact vulnerable populations who do not have access to the internet? And now I'm really thinking about our rural older adults where there really is no internet.
Yeah, I mean, so there's several layers to that question, obviously. One piece of it is just the pure physical infrastructure that needs to happen. And if I get my way out of COVID, we're going to have an equivalent to the rural electrification program. We're going to broadband the shit out of everything. Sorry, excuse my language. But this is going to be exactly that. Like if we can't run a T1 line to every shack in Appalachia and we can't get freaking internet to half of West Louisville right now, and it's 2 seconds from downtown. We need a rural electrification program that just makes broadband a right in the way that we say water and electricity is a right. So that's one piece of it. There's a second piece of access to technology that is not about the physical infrastructure. It's about, is technology accessible to me as a human being? And that is a separate and really important stream of work to make sure that every person, regardless of the age, has at least a basic understanding of how to navigate the Googles. And more than that, can see themselves in a tech career. So one of the stories or questions I like to ask is, why did Uber start with black cars in the most transit dense city in America? Well, it started with black cars in the most transit-dense city in America because the sort of human who understood mobile technology, cellular phones, and had access to the financial and entrepreneurial resources to scale that opportunity were the people who were driving home from JP Morgan at 10 p.m. and were irritated that they couldn't find a black car. Where that company should have started was at the end of the Tark line in the west end of Louisville, where people whose car, their capital asset, would have been a huge value for them, and they could have helped bridge that last mile problem of getting people to family supporting jobs and GE appliances. That's where that technology should have started. But we did not make that technology available to them. I mean, this is, I don't know how many of you guys have used Slack, but it's this giant overdeveloped AOL instant messenger, right? I remember using this technology in the 90s. Like, okay, so there's channels, but basically this is the same thing. Because the technology innovation of this now billion-dollar company was driven by computer dorks on the West Coast, who, by the way, mostly look like me, right? And we still don't have a technology where nurses can change shifts with each other online. Are you for real? Why has no one built a nurse shift change technology? Right, because nurses don't feel like they are part of that data and innovation economy, and we need to change that fundamentally.
Here's another important question from Barbara. It says, can you speak about the haptic skin virtual sense of touch works, and how does it work, and how close is it to being available?
No, I can't.
We heard about that the other day.
I know the word haptic from the movie Ready Player One, but that's about as far as I get.
Joy also mentions that it would be great if the Alzheimer's Association Memory Cafe could be transitioned to a virtual cafe. And I think that is actually something very interesting to consider. And Larson is asking, Ben, you have important and inspiring expertise and future-facing vision about digital transformation, healthcare, business, workforce, education, and other areas. What are your thoughts about public education in light of today's seminar and the current and post-COVID-19 era? K-12 education, higher education, the community. What you have learned from co-parenting your children this spring in virtual learning environments, and how can we adapt to and adapt new DT environments for learning and close DT inclusion?
And you're too nice. Yeah, what if we just blew it up? Right? The education system right now, what if we just stop saying we're going to go back? We're not going back. Right now, we've been talking for decades about how do we differentiate learning for different learning styles and different learning levels. What if we took this moment to actually, don't quote me on this. Oh, you're recording. Okay, I got to be a little careful here. I'm not going to call this defund the teachers, because that would be terrible branding. But the point that there is a different skill set to getting to the stand and deliver kind of teacher, right? Stick me in front of a classroom. My hands move all over the place. I can tell funny jokes. Like, I'm super good with teenagers. It turns out, terrible at 4th grade Spanish. But I've only made my kids cry twice while doing distance learning, right? Twice? Yeah, twice. Yeah, I think I only made them cry twice. But what if we just blew up the whole thing and we said, there's a stand and deliver teacher, and then there's a social work teacher that checks in on every kid every day, right? And then there are people who say, oh, there's basic needs that get, and we staff towards that, as opposed to saying, hey, listen, every teacher needs to stand up in front of a classroom, and that classroom needs to be in person, and those 20-something kids are going to absorb that information, and then the teacher's going to watch them. Like, what if we took this opportunity to fundamentally say, something different about the way we do online education? Like, so that's where I think, and the real opportunity here, and this is where, again, I think U of L has the opportunity to really lead, because we've got this incredibly innovative school of education. We've got this opportunity. We've got the Delphi Center. Like, let's blow it up. What if you never go back to seeing patients? What if you only went back to seeing patients, in these very limited circumstances, but you really optimized to take advantage of all the things you can do remotely that now you can't do. You don't have time. And by the way, our economy is going to be destroyed for the next several years. I don't know if anyone has been really talking about that because we've been very focused on the crisis. But what if we split up so many of these jobs for our displaced restaurant workers and said, hey, you know what your job is today? I'm going to hire you at $20, $15 an hour, and you're going to check in on every patient I have over the course of a week. You've got 300 people to tele-check in with. Oh, I can't get a hold of you because you haven't figured out the technology. Instead of saying, I throw up my hands, what if you said, okay, great, now my job is to fix that, right? Which you can't do. But a displaced restaurant worker could absolutely strap on an N95, put some booties on, and take an iPad to someone in their home, and then work with them every day until they figure out how to get on a Zoom call. They'll never figure out how to mute and unmute. Let's just give up on that. You know, there's certain limits as you age that you just can't do. It's fine. It's different for different people. The mute button is not happening. But like that, so that's where I think there's real possibilities here.
Thanks, Ben. Colby is saying, analytics are so important for receiving and renewing grants. Is that a good area of focus, at least initially, in terms of changing the culture at the leadership level? Data equals funding, or does it need to go beyond that, and how?
So if you think about the economy in terms of, this isn't a technological effort, pull it out of IT. This is a culture change effort. This is a business process effort. Right? That's the fundamental shift that needs to happen. Now you start saying, well, what are my most important business problems? And as far as I'm concerned, the first test cases here need to be high financial return. Right? We just need to demonstrate that we can make a boatload of money by embracing analytics. So if that's in grants, great. That sounds awesome. If that's in billing, that's fine. I don't care. What I care about is that we're going to transform the culture of our organizations. And the fastest way to do that in this environment is to make things cheaper or more efficient. So let's go do that. And then we'll figure out all the other cool social good stuff. You know, actually, Colby, I will add one other piece to that, which is that what we have never done a good job of really doing, which the analytics, the data revolution offers us the opportunity, is really making the financial case for social good. You know, we talk about isolation all the time. We know it's a thing. It's like smoking a pack of cigarettes every day. Great. Prove it to the insurance company who will pay for your anti-smoking problems, but will not pay for the Alzheimer's virtual cafe. Right? It's the same, it should be the same bucket of cash.
Where do we start, Ben? Do we go to Frankfurt? Do we advocate for more money? Do we advocate for policy change? What do we do?
No, there's no more money. Where it says, stop it. There's no more money. Money is gone. Start with the thing that pisses you off the most. Right? Whatever it is that makes you, I mean, this is what I say to entrepreneurs all the time. People come in and they say, you know, I've got this great idea and I want to, so this is my own medicine. A maternity store on the east end of Louisville was going out of business. And my friend says, do you want to buy this store? It's really cheap. And I said, I don't know anything about maternity clothes. However, my business school classmates started Rent the Runway. And, I think there's a market for rental maternity clothes. What a neat idea. And if we've already got a brick and mortar store, we can just add an online component to it. We can test this out. And I get like full down, I make financial models and I'm like, I'm going to make $1 bajillion. And then one of my advisors says, hey, 6'6" white dude, you know 0 things about this market. And it's not really irritating to you. And when things get hard, you're not going to be the right person to deliver the message or to solve the problem because you don't understand the nuances. So Dr. Paul, what I would say is, you know, you got to start with the things that really make you mad. How do we fix the things that irritate you? Now, to Colby's point, it's so much better if you fix the things that irritate you that also cost a lot of money. Right? Some inefficient thing where, but we're not gonna, there's not enough money coming down from on high for us to say, oh, we got to wait until we can reinvent our entire thing. What we need is, hey, you know what I've got at the University of Louisville? A bajillion data science interns. How do I hire a bunch of data science interns or come talk to the Future of Work initiative and make me an entrepreneur in residence, and I'll come muck about in your data and we'll find some financial returns for that. You know, whatever it is that irritates you, let's start there.
Any other questions from anyone? It says here, Joy is saying insurance companies that decline older adult services needed. Yes.
Yeah. I mean, we
that
gotta,
is one of the
yes.
things that irritate me.
Yeah, we gotta make a fundamental financial case to the payers that investing in older adult services makes money for them. And by the way, it's better for everyone. But that's we gotta figure out what language it is they need to receive that information in, because we made the case. Like we know the answer. Like, this isn't like with rocket science. We've been doing this for a while now, but we have not yet translated that into a language they can absorb. And as soon as they can, I mean, listen, they figure out all sorts of ways to make money and save money.
So what you're saying,
from
Ben,
your lips
basically,
to God's ears, Colby.
Yeah, so insurance companies don't realize that prevention is cheaper than surgery and prescription coverage. So what we need to do is make the case for the money talk. And then Catherine asked,
so
do we have enough widespread data literacy? Sorry, Ben, go ahead.
I want to talk to Colby. Hey, Colby, let's think outside the box here. Let's solve 3 problems at once, right? Let's do prescription adherence, let's do social isolation, and let's do the costs of in-home care. And let's set it up so that we've got a social worker who tests the idea that if an older adult is supposed to take medicine 5 times a day, 5 times a day, somebody calls them, hops on the video screen and says, hey, you know, Colby, I haven't talked to you in a little while. How's it going? What'd you just do? I think now is blue pill, green pill, and, you know, whatever. Great. You could probably do that with volunteers or interns. This doesn't have to be like a bajillion-dollar experiment, but you got to first structure it so that whatever results you get, Humana, Anthem, U of L Insurance, somebody can be able to absorb the results of your research. Right? I mean, we can do it, but if they can't learn from it, it's not going to scale. But hey, man, prescription adherence costs a huge, like, we know that by itself changes the amount of what it costs for an older adult. And by the way, part of the reason for lack of prescription adherence is that some older adults might want to have the complications that come from that, so that they have the interaction with the people who come for care. So let's just knock that out of the equation. And by the way, you could probably create accountability groups like you do with diabetes. I mean, there's lots of ways to go at this that you're taking multiple problems and addressing them together. And I think that's the real opportunity right now. Like, never are insurance companies going to be more interested in doing this than they are right now.
One more question for you is, do we have enough widespread data literacy for this new world? And if not, how do we solve that problem?
So that we got to invest in. Now, the nice thing is that the investments don't have to be all financial, but there's some real opportunity. So if you think that what we need is a broad population that all understands enough about data to make a financial case, right? Or to help create this. Most of the programs needed to do that are about the level of technological sophistication as Excel. And a lot of those training programs are available for free online. U of L has this fabulous portal that you can go through the Center for Digital Transformation, where you can see all these available credentials through IBM and Microsoft. And because Microsoft pays my salary, I'm not allowed to refer to the G who shall not be named, but I hear they have good stuff. So it's really about, can we connect people and recognize and reward them for doing those trainings and badges that will give them a level of comfort with the technology that they don't currently have? So the answer is no, but the solution doesn't have to be, I get a master's in analytics, although that's a great idea. It does have to be that we need to engage data literacy as an integral part of every program, right? You should not be able to graduate from the University of Louisville without A, having an internship somewhere, anywhere, and B, just like you have a set of English courses, you need to have a set of data courses. I just need to know that somewhere in here, I can make these numbers turn into a picture.
Thank you, Ben. So Joy is saying, and she's making a good point. She said it's like Jeopardy, start with the answer and work into the question. And then she's also asking Whitney Nash, is this an area where the U of L School of Nursing can be involved? Whitney, are you available to answer that question? I'm seeing Whitney is on, but she may not be hearing the question. It seems like all schools need to put that focus on awareness of data and data literacy. And so we are right now developing all kinds of manuals to help older adults access certain technologies. Do you recommend manuals, or do you recommend more of a personal touch to that learning experience of, yeah, I see you?
Right. We got the same thing for just education in general. Let's reinvent it. Right. It's who reads manuals? I don't read manuals. I barely watch a TikTok. But if you can make it as, which is an 8-second or 14, 15, I should ask my kids how long a TikTok really is. But if you can make it personal, it's so much more likely to work. Or make a video and then a chat that's you know, hey, try this. And if it doesn't work, click this little picture of you know, Ann Larson's face in the bottom corner of the screen, and she'll answer your question.
Yeah. Good. That Joy is saying personal touch. We should use personal touch to do this. She's talking about students in community health class rotation, students in social work and nursing. All of these are really excellent ideas that we can try to uncover for ourselves. Any other questions that anyone may have? Seems like someone is asking, Justin, is the caregiver program just for Louisville or Kentucky residents? And basically I can answer that question. It is for the 7 counties area surrounding Louisville. There are other programs, there are caregiver programs in other parts of the state. If you do not live in the 7 county area surrounding Louisville, you can also contact the area agencies on aging in your district, and they will tell you about the caregiver program in their area. You can call or email us and we can guide you more as to where to go. So with that, it seems like we're at the end of our session. We want to really thank you for spending time with us, Ben. It was very informative, and we really enjoyed this discussion. Next week, we're going to talk about the reopening of churches, and we're going to have a panel here. It's more about all kind of religious groups who want to come together again, and how do we do that in a safe way. So thank you so much. This was a very nice and really informative discussion. Thank you, Ben, and we hope to see you soon.
Thanks for having me. Take care.